So, afternoon everybody, it is great to see you. Hello, my name is Jenny Lewis, Director of HR and OD here in Leeds Teaching Hospitals. Looking at the agenda that we've got in front of us at the minute, that looks awesome. So, experience tells us we need to give people as much time as we can to be able to report out. So I'm going to hand straight over to Rebecca Town from the neurosurgery team. Can't wait to hear all about your work about HOBS on L25. Rebecca, over to you.
Hi everyone, thanks for having me. So yeah, this is just a little bit of a presentation about the high observation beds in the neuroscience CSU and how we've developed the area, what it is now. So can I just have the first slide, please? Thanks. So yeah, this is just going to be a bit of background about HOBS and why we need them in our CSU and the trust really. So nationally it's been recognised that there is a need for the development of the higher observation beds, and it's to ensure we can provide the correct level of care for our patients. There's been increasing pressure on critical care due to the COVID-19 pandemic, and our elective activities at risk due to critical care capacity, and it's likely that this is going to continue for quite some time. And we've recognised this in the neuroscience CSU. And we can see that there are a number of patients that we have admitted electively and acutely that just require intensive neurological monitoring. And these patient needs can be met in a HOBS area with the increase in monitoring, nurse to patient ratio and additional medication management options, those which were not currently safe to be delivered on the ward. Providing a safe environment outside of critical care for this group of patients will have this knock-on positive impact on the bed state in critical care, but also ensure that our patients have the right care at the right time by the right people. We've followed guidance from the Faculty of Intensive Care Medicine and the National Outreach Forum, and we've begun by having a strategic development approach, building a team of stakeholders to ensure we have a robust action plan for our successful delivery of HOBS in our CSU. Next slide, please. So yeah, this is just a bit about how we've developed the area. So I was appointed to be HOBS lead in May of this year, and the first challenge I had to overcome was that I've never been in a project role before, and I gained advice from others who have had project experience before, and we modelled our approach on previous successful projects in the trust. I began by finding out what was required to set up the area safely, and I've visited other HOBS areas in the trust and learned from their experiences, successes and difficulties. I also utilised the Leeds improvement method tools, so things like the driver diagram, the value streams and the 7 wastes, and there's a picture on the next slide which I'll go through. But it really helped me develop my vision and timeline alongside creating an action plan. And I've used a phased approach in the development of HOBS and just reviewing as actions and adjusting as necessary. After carrying out our research, we found out that what was successful, what made HOBS successful was that it needed to be purpose-built, self-sufficient and have its own identity. I reviewed the area available on Ward 25, and we've worked really closely with the Estates and Planning Department and worked through a process of gaining planning and funding and implementing it to ensure that we have the right development for the area. And whilst looking at the best location for HOBS, I wanted to ensure we developed the area appropriately to meet all our patients' requirements. And we've developed a really strict patient criteria and admission list, and it really helped us visualise and understand what the area needed to ensure that staff are able to provide that safe care. And that's from having the equipment to hand to having the support from medical staff outreach, and then also having protected staffing for the area. The key to the project having the drive and speed at which we've acted on our ideas stems from the fact we've had continuing fantastic support from our neuroscience senior management team and all the stakeholders involved. I've presented my work at weekly project link board meetings, and that's really focused what we're working on and what support we've needed, and working as a collaborative, we've bounced ideas off each other, which has meant that the project has kept up with momentum. I've also presented my work at governance meetings and worked closely with the critical care team and deteriorating patient team, and that's ensured the development has been done right, and it's an area that so many people can be proud of being part of. Next slide, please. Yeah. So this is just screenshots of the driver diagram, the value stream and the 7 waste tool which I developed, and I found them really useful when planning the timeline and action plans in the development of HOBS, and it really made us focus on the reasons why HOBS was needed, and it ensured that we remained focused on our end goals, which are primarily improving patient safety, their patient journey and their experience in our trust. So just an example, because I know that they're really small for you to see. So for the driver diagram, a primary driver was to improve our patient flow. secondary to have improved waiting lists. And again, that links to the wastes being, time and cancelled surgery. And the change idea was to early identify patients who would be suitable for HOBS and to schedule them appropriately. Other wastes in our process which we identified were delayed step downs, and also the financial cost of patients staying in a HDU bed over a ward or HOBS bed. And this helped with the development of the value stream, where I gathered data linking to step downs and who would be suitable for HOBS rather than a critical care bed. So an example of the data that we gathered, just as a bit of a snapshot really, for step downs from a critical care to our wards 24, 25 and 28, just in a month period of March to April, 61% of patients who were stepped down would have met our criteria for the HOBS beds, and therefore that's creating, that critical care bed capacity which we really needing. I also worked closely with the subarachnoid hemorrhage specialist nurses, and we've audited patients, and again between that same period, March to April, 16 patients were stepped down onto our wards, and 10 of those patients would be suitable for our HOBS beds, again freeing up that critical care bed capacity. So we carried out this data over a few months, and overall the data was slightly varied, but the clear message from the data was that HOBS beds really are needed in our neuroscience CSU, and there are a large number of patients that would benefit from the investment and the development of the area. In each element of the diagrams, we followed up with an action with an aim to improve the waste in our process and patient journey. Next slide, please. Thank you. So yeah, some problems and challenges we did face, and previously HOBS was implemented on 25 3 years ago, and it initially worked really well, but the few challenges that we faced getting it off the ground, and the main thing was lack of understanding of what was needed for an area. And we now have the guidance from FICM in the service development of HOBS in the hospital setting, and it's really helped us to understand what we need to make this area successful, and they're things like the strict patient criteria group, protected staffing and a self-sufficient environment. One initial challenge as well that I faced was regaining staff's trust. So the previous experience of HOBS was quite difficult due to staffing pressures, which caused the beds to be shut and not having that protected staffing. I've been really honest with all the plans and discussing staffing openly with them and how it's going to be managed this time, and I really wanted staff to feel valued and appreciated in their job role. I recognised that there was a lot of anxiety around new skills and education, so I developed a dedicated study days which were protected for RNs and CSWs, which concentrated on HOBS and the deteriorating patient. And we based this on the national competencies from North for the RNs. And then I also developed a band 2 and 3 competency booklet as well to make our junior staff members feel valued working in the area as well. And I really wanted the study days to be beneficial for all the staff and engaging. And I tried to think of different ways for developing education on the day. And I've had speakers from the specialist nurses, the clinical education team and tissue viability to provide a thorough study day, which covered all sorts of different elements. I also developed games to play with staff to help them remember the information provided. And an example of a situation which our junior staff particularly struggle with is when we've got an emergency situation and they're being asked to get some equipment and they might not know what that piece of equipment is or what it looks like. So on the study day, we had a section about the deteriorating patient and their role in the recognition of them and what the equipment is called in an emergency situation and how it is used. And we created a pairs game which added an element of fun to the day, and I found it really captured their attention and added a bit of a competitive element to the learning, which I found a really good, useful tool and engaging for all the staff. And we all love an opportunity to win a bar of chocolate, so it really helped. I also asked for feedback before and after the study days, which showed a really great improvement in people's thoughts about HOBS and working in the area. And when discussing with staff, the feelings around HOBS, they really greatly improved after the study days. And with that really good communication, it's also increased staff morale on the wards, which is excellent. Next slide, please. So one of the outcomes after all of the planning and preparation that we've done was that we've finally got approval of our business case, and we got funding approved, and the work has now commenced on the ward to develop the higher observation bay, and we aim to open for admitting patients towards the end of November. And as you can see on the slide, the top picture is of what the area looked like originally, and then the bottom is with the development and the investment, and it'll have its own nurses station and treatment room, so the nurses really can provide the care at time of need and have the equipment to hand, which is really key. I've also worked really closely with critical care in the deteriorating patient group, pharmacy and medics on the ward, and we've developed pre-printed prescriptions for all the new medications that are going to be used in HOBS. We've also developed risk assessments for the new patients and working alongside the deteriorating patient group to standardise the education across HOBS, across the trust, and hopefully we'll get some sort of unity. We're also going to be the lead area in the Trust for online documentation for a HOBS area. And I've also been asked to work alongside Leeds University in relation to data visualisation and seeing how they can use our HOBS data for their PhD and master's studies and see how we can link into them for research, which is really exciting. As a teaching hospital, we can do that. Next slide, please. So I'm really proud of all the staff that have been involved in the development of HOBS, you know, ward-based staff, the ACPs, critical care and estates, and their enthusiasm and passion for it has really meant that we've been able to progress this project really quite quickly, and everyone involved has had a really can-do attitude and been extremely positive when approached to support, and it stems from everyone having a solid understanding of why HOBS is needed, and we can all envisage the positive impact that this will have on our patients we're caring for. Everyone in the neurosciences CSU is excited with the development and really keen for the area to be open so we can put all our hard work into practice. Next slide, please. So the things that I would do differently. So one rock in my shoe during the planning phase has been the ordering and timely supply of equipment needed to run HOBS safely. There's lots of pressures on services which we've had to ask for extra support from. And one team could, for an example, is the point of care team, and they've been really key for getting the area set up appropriately and having staff trained on the new equipment that we're going to get into the area. And I know that it's been an extra pressure on their department, but we're so grateful that they've been able to take on this work and that they've been able to support HOBS. But I know that that has been difficult for them. Another rock which we are currently in the process of resolving is that there are significant delays in the supply of computer equipment, tablets and laptops, and you know, we need those so that we're able to be that lead area in providing the online documentation, which we're currently resolving, but that has been difficult, and I know that there's been supply issues in the trust. Other challenges that we foresee that could be a problem is that when HOBS opens, it's ensuring that our bed usage is appropriate and that the beds are utilised to their fullest. I'm working closely with the scheduling team, the bed management team and the patient flow team for neuro and spines. And alongside with the consultants, we really want to ensure we identify our patients who are suitable for HOBS at the earliest possibility, and we recognise how long the patients require their, you know, the HOBS stay, so that we can schedule our patients appropriately, and then we get through, you know, some elective patients who have been waiting for quite some time, which is really key. Next slide, please. So when HOBS opens, I will continue to monitor its progress and challenges, and I'll definitely be utilising the PDSA cycles which I've learnt about during the Excellence in Practice course, and ensure we're always striving for the best and we have a positive impact on our patient care. We will have our data collection separate to the ward and monitor HOBS progress regularly, looking at pressure and falls, mixed sex breach, and that's just to name a few of them. But we'll constantly review the data and see how we can make changes necessary to ensure that our, you know, we provide the safest patient care and experience possible. Alongside this, we'll complete daily audits to make sure that our beds are being used correctly, and I'm hoping that that will help really justify our nurse to patient ratio, and you know, the increased nurse to patient ratio from the ward, which hopefully HOBS will keep and be protected. I'll also ensure that we get staff feedback, you know, after the area is opened, to see how that people feel working in the area and that they continue to feel valued and supported in their role working in there. And I really hope to empower them to develop change ideas and to follow these up with actions. And it links really well with the excellent work our CSU is doing with the staff engagement, following the staff survey results and things. So hopefully we'll empower staff to make some change as well in the area, which would be fantastic. Next slide, please. So HOBS in neuroscience is still really in its early stages of development, and I'm really excited that HOBS is going to open really soon in the near future. And I'm sure that we'll see a huge positive impact on our patients and also within critical care and the bed capacity. And I would love to come back and present the progress and success and challenges that HOBS encounters in a future report out meeting. But that's it from me. So thank you for listening, and thank you to everyone who has been involved in the development and investment of HOBS. Are there any questions or comments?
Wow. So Rebecca, our standard work is that we hold on to some questions to the end, if that's okay. And we've got another report out. But I've got to say, if that was your first project, I am absolutely astounded. So well done.
Thank you very much.
Conscious of time, you should be incredibly proud. I'm going to hand over to Mark Edwards now.
Okay, afternoon everyone. For those of you who don't know me, my name is Mark Edwards. I'm the Head of Resourcing and Workforce Systems at LTHT. Along with Julie Sutcliffe and Andrew Blakesley, we've had the responsibility for the setup of the HR and rostering teams at the Vaccination Centre at Ellen Road, which has involved the recruitment, rostering and payment of over thousands of staff, which has been both a major challenge and an achievement for the team. So firstly, can I just start by introducing the great team of people we have on the call today. So we've got members of the HR team, payroll, rostering and recruitment from the Vaccination Centre, all of whom have played a critical role in responding to the daily challenges and changing priorities, but more importantly, at the same time, making our staff down there feel both valued and engaged and part of the Leeds family. So some of the team are existing staff on secondment from LTHT, but approximately 60% were recruited externally to the Vaccination Centre, and we've really managed to recruit some amazing talent as part of this programme. So lots of good people out there, and hopefully they'll stop with us following the Vaccination Centre. Next slide, please, Adam. So apologies if you've heard this analogy before, but this really sums up what it's been like working in the Vaccination Centre and building the plane whilst it's in flight. Julie will elaborate a little bit more about that in a second, but I think it's fair to say that the setup of the Vaccination Centre has been both a unique and a monumental challenge, and one which has demonstrated the agility of both of our operations and support team at LTHT and shows the true value of the Leeds improvement method in action. So on that note, I'm going to hand over to Julie, who'll just expand a little bit more about some of the challenges we've faced right from the outset. Thanks, Adam.
Hi, my name's Julie Sutcliffe and I'm Head of Medical Workforce, and have been working alongside Mark to establish the HR and rostering team. So I think really one of our key challenges within the Vaccination Centre has been establishing a robust and sustainable workforce in an ever-changing environment. And when I say ever-changing, I mean every 2 minutes, things change from one meeting to the next. So we established the vaccination pods in Thackeray in December 2020. We opened 3 pods at that time, and they were predominantly staffed by our own staff who were seconded from LYPTF, LCH and LTHT. And then we opened the Ellen Road site in January 2020. And I think it's really key to say at this point that we were doing all of this really in the absence of having an established either rostering or HR team, which the team will talk in a little bit more detail further on in the presentation. So initially when we were rostering up at Thackeray, they were predominantly done on paper rosters. We had staff from a lot of different environments, staff on bank contracts, so a high number of staff for a small FTE, which was really complex and difficult and challenging to roster during that time. Since we've established the HR and the rostering team, we have now moved fully onto an electronic rostering system, which gives greater visibility and a greater capacity for the staff who we have got working in the vaccine centre to see the rosters and to book into their own shifts. So we undertook a citywide recruitment campaign, which included 14 pipelines to process and appoint applicants. And again, that will be covered in more detail later on in the presentation. Of those 2,000 expressions of interest, we were able to appoint just over 1,000 staff into the vaccination centre, the majority of which were actually on 0 hours contracts. So again, that adds to the complexity of most staff had substantive full-time jobs elsewhere and were offering us between 8 and 16 hours a week. So of those 1,100, 600 were around about FTE. 75% of the FTE were bank workers, and which meant that we actually have an average whole-time equivalent of below 0.1 per person, which again just adds to that complexity of how do you build this jigsaw when you're doing 2,000 pieces, whereas in a normal work environment we would have a smaller establishment and be able to roster those people. I think one of the other challenges that we had was the ever-changing supply of vaccine and also the uptake of vaccine from the general public. So it meant that quite often we were scaling up and scaling down those pods at Elland Road at very, very short notice. And sometimes we would need to cancel some of our bank staff, move them onto different shifts. And during that time, we had to make sure that we really kept those staff engaged so that they would come back and work for us. And, you know, we needed to really keep those people on side and ensure that they had offers of work. So I think overall, really, what we had was a context where we had a flexible workforce, quite a large workforce with a low FTE, which presented a huge number of challenges and still presents a huge number of challenges around how we roster those staff and staff to the capacity that we need to on a day-to-day basis. So I'll now hand over to Cam, who is the HR manager for the Vaccine Centre. Thank you.
Hi, I'm Kamal Kaur, the HR manager for the Leeds Vaccination Centre. So this slide just shows all the different pipelines who worked together back in late 2020 to recruit the workforce that was needed. The model was for 2 phases. Phase 1, which was care home residents, over 80s, health and social care staff. Phase 2 was for other staff in the mass vaccination programme. Phase 1 commenced in December 2020. It was amazing to see how everybody worked together to get this workforce in place in a very short period of time. Next slide, please. Those efforts were reflected in the steering group being shortlisted for the University of Bradford Award for cross-sector working in the HPMA Excellence in People Awards for 2021. Unfortunately, we didn't win. However, it was good to see that the judges recognised the good narrative with honesty and learning at its core, which really hits the nail on the head. Next slide, please. So these are some of the key actions that were taking place. This has really helped us, in line with the Leeds Way values, to develop better and consistent communication through regular Q&As, regular bulletins. It's given us a clear understanding of the direction and the changing demands of the project. It's given us a clear focus of what the targets are, which, as Julie mentioned, in a project like this changes all the time. It's allowed us to bring in our own training pod in-house to give us better control over the training of our staff. In a project like this, where we don't have clear answers for our candidates who have very kindly paid an interest in helping to keep them warm, it is vital. So regular surveys has really kept those lines of communication open and kept those candidates engaged. Managing their expectations has always been a challenge, and we found over time just being open and transparent has really helped that. Working with our colleagues at the Vaccination Centre has helped us to provide a more proactive service rather than a reactive service. This project's really given people in the community an opportunity to gain new skills and knowledge that, if it wasn't for COVID, they might not have considered. We're looking now at how we can try and repurpose those skills and knowledge after the project does finish, which my colleague Nicola will go into a bit more detail. And obviously all this was happening at a time where we were in lockdown, so very different challenges. Working virtually, by working with our partners, we've learned to work differently, and by sharing best practice, that's really helped those challenges. Next slide, please. So this just gives a bit of a snapshot of the number of candidates we were recruiting between March 2021 and present. Due to the large number, it was split into 2 groups, the student pipeline and what we called the LTH pipeline, which was for all the other pipelines combined. Our teams, our HR and rostering team, weren't actually in place until February, March 21. So those first stages of recruitment were done by our partners. Next slide, please. I'll just hand you over to my colleague, Nicola, now.
Thank you. So my name is Nicola Poole, HR advisor for the Vaccination Centre. So as a short-term project, we have to have our eye on the future and what steps we need to take to ensure that everyone who contributes to the Vaccination Centre has a clear picture of how the changes will impact on individuals. This is a multi-stranded approach. So we need to consider contract extensions for fixed-term contracts and bank contracts, which make up the majority of the workforce. We're also mindful that staff who are on loan from Leeds Community Health, Leeds and York Partnership Trust, Leeds Teaching Hospital Trust, and the communication between managers in these trusts and the Vaccination Centre to work through on an individual basis. And also for the continuation of the Vaccination Centre, we've got ongoing recruitment campaigns, and also to consider when the project is decommissioned, that this is carried out in a sensitive and respectful way, that people feel treated fairly and consistently. Next slide, please. So in terms of successes, the core success has been of the vaccination centre has been the people and its teams. The HR team, for example, has had to change and grow with the demands of the vaccination centre. Originally dealing with recruitment pipelines, data entry and contracts, this has changed into a period of establishing processes for payroll queries, HR relation issues, recruitment campaigns and contract extensions. And going forward, we need to consider decommissioning, all within the uncertainty of working on a temporary project. Alongside the major successes have been working as one big team, which has provided a skilled and trained workforce, which has helped the project to be successful. Recruitment, e-learning, face-to-face training has all created the right workforce at the right time to deliver vaccinations. We've seen the benefits of working with partners and sharing resources and mirroring tried and tested processes within the trust. Next slide, please. So what would we do differently? Firstly, in terms of processes, when you have an overwhelming response to a national request for help, as shown by the recruitment pipeline slide, to mobilise a new workforce quickly, with the realisation that established recruitment processes couldn't cope and created barriers, which then leads on to alternative strategies being developed. Secondly, communication. The key element is better communication right from the beginning. The workforce appreciates open and honest dialogue. We're relying on goodwill, temporary contracts, when staff often have commitments elsewhere. And thirdly, feedback. We would encourage more feedback using exit interviews as a priority to feed into strategies and planning. The staff survey currently allows for an opportunity for us to gather feedback at this point in time. Thank you. I'll hand over to Adam now.
Thanks, Nicola. Hi, everyone. My name's Adam, and I'm one of the Assistant Vaccination Deployment Managers for the centre. So we faced quite a lot of challenges as we began to standardise and manage our workforce. So we knew that the structures and processes we had in place really needed to demonstrate and positively affect our daily operations at the centre. So one of the really useful tools was our virtual production board that we used via Trello. And this really helped with our team collaboration, our productivity, giving clear delegations of tasks, allowing us to work to particular deadlines and ensure work isn't missed or duplicated, which will help minimise waste and ensure our leaner ways of working. The team had a huge task when it came to managing staff expectations, as we initially had everybody working whatever it is that they could. We basically threw the kitchen sink at the programme. So then as we quickly realised how unsustainable that was going to be, we needed to create working patterns to allow not only ourselves, but for our staff to feel secure as part of a core workforce. And this was a crucial element as we started to realise that this programme was going to become more longer term than initially thought. We needed to offer some stability and assurance as to the ask for both our administrative and clinical members of staff. We knew we needed to cement our presence in the programme, so we made sure that we attended staff morning huddles and the training sessions, allowing for any questions and concerns to be raised and set those expectations as to what was needed as a service from the outset. We also created a timetable for those staff that self-book or those that are on our bank, so that we know what shifts are going to be available when, and allowing them to plan ahead and still keep a good work-life balance. So with these steps that we put in place and the amazing team that we do have, we've been able to cover over 35,000 shifts for this programme. So even though it's been very chaotic and all of us at some point have wanted to run for the hills, we've always managed to deliver. Sometimes we question how we got there, but our achievements as a team and as a service as a whole really do speak for themselves. So thank you, and I'll pass over to my colleague, Dan.
Thanks, Adam. I'm Daniel Callahan, and I'm the other Assistant Vaccination Deployment Manager. Due to the frequently changing demand, as well as the flexibility available to staff at the vaccination centre, it's vitally important that we keep track of all staff's hours. Although we are fortunate to have a system that has the ability to calculate and track net hours for staff, the data proved to be unreliable due to a number of factors. We started by identifying all staff who had been recruited to the vaccination centre on a fixed-term contract. We then manually calculated the net hours for these staff and compared this against the net hours on the system to see whose net hours were incorrect. We looked into any staff whose net hours didn't match and checked a number of factors, including their start date, contracted hours, and whether their contract had changed. Once all investigations were complete and the rostering system was updated, we rechecked the net hours and found that most of the staff now matched. Now that the majority of the staff's hours were correct on the system, a standard process for monitoring these could be rolled out to the team. This process included a weekly check of staff's net hours, which were recorded on a central spreadsheet, communication and action guidance for the team when contacting staff who owe hours. These differ depending on the amount of hours owed and if it is above or below two thresholds of 10 hours and 15 hours in line with the wider trust, and 3 escalations to follow if staff owe above a set amount, if we're struggling to get hold of staff, or if there are any unpleasant conversations. And at this stage, myself, Adam and Rosie as managers would offer support, as well as HR and the line managers of the staff who owe hours. The checks are carried out every Tuesday, and then we have a review meeting every Thursday to discuss any issues. And for the remaining staff whose net hours were still incorrect, we manually calculated their net hours while continuing to investigate these further. And once the issues were resolved, these were shared out to the team to action each week. What's next? We're also looking into any staff who have changed from fixed term to bank to measure any outstanding balance. And as the project moves towards the latter stages, the team will continue to monitor all staff's net hours, ensuring there is as little hours owed as possible by the end of the project. To conclude, this piece of work has put us in a position of control by allowing us to gain a full understanding of the net hours of all staff within the vaccination centre. It has significantly reduced the amount of time spent on the vaccination centre monthly payroll, which has benefited both ourselves and the payroll department and has served to further strengthen relationships. And finally, it has resulted in the reduction from 3,351 paid unworked hours as of the 18th of August down to 512 hours as of last Sunday. That's a reduction of nearly 3,000 hours in the last few months alone. And with plans already in place to see this decrease further, we look set to clear the majority of the deficit in the next few months. Next slide, please. I'll now pass over to my colleague, Rosie.
Thank you, Dan. Hi, everyone. I'm Rosie. I'm the Vaccination Deployment Manager for the centre. So what would we do differently? So just like the HR team, we would establish our rostering team much earlier in the programme. This would help offset processes and procedures. It would assist in laying down the new foundations and give our best input on how to roster better. Secondly, thinking carefully about the mix of workforce and having more of a core team with less dependency on bank and ad hoc staffing. And as Adam alluded to earlier, we'd make sure shift designs are clear at the outset in terms of expectations and ask ourselves, what do we need versus what do staff want, and how do we find that balance? Next slide, please. So ending on a huge high note, what went well for us? So firstly, let's look where we've been. You can see on the slide a snippet of all the pop-ups we've done, to which all have been a huge success. A programme that wasn't just Ellen Road, but so much more, which was and still is a huge team effort. Total collaboration across the clinical and non-clinical teams and our partners across the city. Secondly, the high proportion of bank and part-time workers has created a significant additional demand for recruitment, training and rostering. Leeds Teaching Hospitals has an strong team in these areas with access to the appropriate technology. This was essential to the programme's success. And finally, discovering new talent. What an amazing opportunity to find people from all different paths, bringing them into our community and supporting them with a potential career in the NHS. Thank you for listening.
Wow, 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 wow. So Mark, Julie, Cam, Nicola, Adam, Dan, Rosie, I know you all personally, obviously, but what a phenomenal second part report out. So we will hold on to our standard work. I'm going to move on now to another very, very pleasurable part of the agenda, which is to be able to give a number of people award them with their Lean for Leaders certificate. So what I would love, just for this bit, is if everybody other than those receiving an award, just for a minute, can pop themselves off camera and onto mute. And those that are receiving award, hopefully you're somewhere where you've got camera and sound. So have we got Angela with us?
Hi, yes, hello.
Great to see you, Angela. And Ben?
I don't think Ben's on the call, actually.
No, I can't see him in the net. Okay, I can see Stephen. Great to see you. Well done. I can see Julie. Congratulations. Rebecca. Lovely, great. Can see you there, Rebecca. Great to see you. Lindsay. Lovely to see you again. It was a pleasure to sign off your Lean for Leaders the other week. We got Suzanne. I couldn't see Suzanne in the list. Suzanne Abrahams. No. Okay. We will do. We will follow up with Suzanne and Mandy. Mandy, great to see you. Have I hope I've not missed anybody, because I've been trying to look at both the agenda and also who is on the call. Somebody check I've not missed anybody. So you'll know me well by now. I would now want everybody to come on camera, take your mics off, and I want you to make a huge, great big noise and really celebrate as I'm handing these people their Lean for Leaders certificate. A massive congratulations. Yay! We will, if you've not already got your certificates, we will definitely get them to you. Huge congratulations. That is, and I know, talking to a number of you, I've seen how you've implemented your learning. So it's great to see some of that getting translated into practice. So what a report out. I'd now like to open it up to everybody else. Comments, builds, thoughts, questions for those that have reported out today or for those that have just received their Lean for Leaders award. Tim, straight off the mark.
Thanks, Jenny. If I may just like to start first by just saying thank you to all of those involved in the vaccination service from the operations side. I know that we were a fairly demanding customer in that sort of short-term scale up, scale down. Have you got the staff for next week when we want to do 6 times as many vaccinations as we did last week, kind of thing? And thank you all for your good humour, making sure the wings didn't fall off. I suppose I was just going to ask about the learning. I know that a lot of the team have been embedded within the team at Ellen Road, and you mentioned attendance and huddles and things, and the reflection on whether we can sort of take some learning from that and apply it to different areas. And then I was also just going to ask about that cross-organisational work and whether we've got anything that we'll take forward for how we work as a city a bit more coherently in the future.
Who wants to take that?
Hi, to answer that, Tim. Yeah, okay, we'll do the latter one last. We're currently starting some work across the city with Jenny and Kate O'Connell, and I've already been sharing some of the learning from the vaccination centre and how we can factor that into the work, because I think there is a lot of learning that we did down there, particularly in terms of the recruitment of staff. I think there's some huge learning opportunities there, and I think, you know, how we've worked collectively with LCH and LYPT, again, lots of opportunities, I think, to look at bank arrangements. We're looking about helping them with international recruitment as well. So I think a lot of learning that we can take from that and build in. So we are mindful of that, and we're learning from it. And like I said, the very early learning point is to make sure we get the rostering team engaged in that conversation, so we're really clear from the outset what the demand is and what we're staffing to.
Brilliant. Thanks, Mark.
Mike, did you want to come in? And then Phil?
Yeah, it was firstly just to say a huge congratulations to the vaccination team, because the scale of the challenge and the complexities are just staggering. And I think it's just a fabulous reflection of the way that we work in LTHT, but also across the city. So it's brilliant work. My question actually was for Rebecca, and just in the neuro HOBS area, just wondering in terms of I think she didn't gloss over it, but I think the complexities of the conversations that she will have had with the teams in neuro to kind of sell the idea of a HOBS, having had the experience that they'd had previously. I just wonder how those conversations went, Rebecca, and whether you think actually, as we move into the operational phase of things, you think that those conversations will ultimately help in terms of cementing the future of HOBS in neuro, because it's been a long time coming, hasn't it?
Yeah, it was quite difficult when I first started. There were quite a lot of anxiety with the ward staff, really, and it really was around like having that protected staffing and having that, like, you know, the knowledge around the increased skill set that they're going to need to have to care for the patients we're going to be looking after. So I've spent a really long time working with the staff on the ward, having really good communication with them, and I think the dedicated study days that we've been able to provide them has given that support, and actually coming out of the study days and having that dedicated time to give them, it's made them feel really valued, and they've coming out of it. And now, because we're getting the investment as well, and we've got sort of new monitors and the equipment that they're going to need, I can say, we have got this equipment, you're going to have it, you're not going to have to go searching for it. They're actually really excited for it to be open, and I think that's because of all the investment and the time that's been put into the area. So hopefully it will run smoothly, but they're also aware that things might not work perfectly first time, but please come and let's think of change ideas and like empower them to try and make change as well. And it's very much their area, because they're going to be working in there and caring for them. So we've really tried to put the staff sort of, as well as the patients, obviously that's really important, but the staff at the heart of when we were setting this up as well. So I hope that's answered your question.
Great, well done, Rebecca, that's awesome. Phil, and then Lindsay.
Yeah, thanks. So thanks, Rebecca, and Mark and Julian team. Both brilliant report out. Sorry, I didn't quite catch the very beginning of your report out, Rebecca, so apologies for that. But I guess for both of you, fantastic achievement. And obviously, the vaccination programme, I think, has been a real success for LTH. But I'm going to ask you the same question in a way to both groups, because I think it's quite interesting how, for you, Rebecca, doing something that was different to established custom and practice, and what barriers and people challenges you think that gave you, because you were trying to change what you were doing. And I suppose it's the same question, Mark, for you and the vaccine team, which is, when you haven't got anything in place, in some ways it seems easier, but in some ways actually harder, because you've got nothing to kind of measure against. So I don't know, Rebecca, if you want to kind of perhaps answer that first.
So engaging everyone into the project, it wasn't as difficult as what I first envisaged, actually, because I think everyone, so from critical care up onto the wards, all the stakeholders that needed to be involved in it, really did see the benefit of HOBS, and everybody understood that it was really needed. I think one of the difficult conversations has been, obviously, once we've got the funding and the beds available, it's then having, we've had to ask for 4 beds to be shut so that we can have the development of the area, and then obviously that's taken time. So that's been difficult, but I think everyone can see that the end goal is in sight. But it's not been a really difficult part of my job, if I'm honest. I think people have been really open in neuroscience and with critical care, and it's just because we all know that it needs to be done. So I know that sounds like a little bit of a gloss over answer, I suppose, but it really hasn't been that difficult. The people have been really, really good, and it's made my job a lot easier because everyone's been so supportive.
Rebecca, you are sound incredibly easy, and I don't think any of us really believe you. I think it's the
I am being honest, I promise you.
Brilliant. Mark and the vaccine team, what about reflections?
Yeah, I mean, I think for me, Phil, what this has sort of demonstrated is one positive thing that COVID's brought is just I've worked with people that I've never worked with in LTHT before. And, you know, I think the challenges of not being LTHT, that it's just been brilliant how people have responded. The challenges have been the national uncertainty and the constant changing direction that's really been a challenge, I think, for us. I think in terms of learning from it, we said a little bit earlier, we perhaps needed to staff more on the HR side and the setup side of it. And when we have learned from that, we did bring Andrew Blakesley in as our business partner, who's been extremely helpful in terms of helping us to build a relationship with our ops colleagues at Ellen Road, which is second to none. It's a real achievement. So I don't know whether, Rosie, you want to add anything to that from your experience of the roster manager?
Yeah, I think when I joined in April, it was kind of, we're so set on doing it a certain way, or it has to work this way because it works this way in trust. So actually using what we do in trust and then adapting it to the vaccination centre, because it's kind of a law of its own, and saying, right, we can use this way, but let's change it to Ellen Road, to the vaccination centre. So it's having an open mind and thinking it's okay if it doesn't work, let's try something else. It's not the end of the world, we'll get through it, and you know, there will be a right way. And it's just kind of trying different shoes on and getting the right fit for it type thing. So yeah, I think it's just kind of having that open mind and sticking with it, and it'll all come together.
And I think
thank you for that. Sorry, Julie.
I would echo what Mark and Rosie said, but I think there's also that, and certainly for myself and Mark, we've stepped completely out of our comfort zone into an area and an environment that was quite alien to us, and we did that for Nightingale as well. And actually to have the support of the people from the whole city behind us, and we didn't get it right first time every time, but actually we had the support then to look at, well, what could we do differently and how could we modify things? I think that's just been really amazing, and that collaborative working piece has been great.
Thank you.
So one more, Lindsay, and then I will bring the report out to a close. I suspect she might be having technical difficulties. I'm sure she will have had something to have added to the working Neuro, but hopefully she can pop something in the chat. So what another phenomenal report out. Great to see the Leeds improvement method really working for us. I loved how you'd managed to bring all of that learning, Rebecca, in from others, and how you really did work with the tools. You did a brilliant job of that. Can't wait to see your follow-on report out. I do remember the day, Mark, where you started to go, we've got to get the Leeds improvement method embedded into this, and it did start to very quickly turn some of that chaos into cadence. So that was lovely to witness personally. And to all of our Lean for Leaders that have now been certified, that's absolutely phenomenal. Very proud of you, and
really stood up. Some of the clinical education